Hello, and welcome to our talk on exercise medicine and physical activity promotion, core curricula for U.S. medical schools. This is part of the Living Library series, which we have put together as part of the 2021 AMSSM Research Summit on physical activity and exercise medicine. I'm Melissa Nayak. I practice sports medicine at Henry Ford Hospital in Detroit, Michigan.
Hi, and this is Chris Miles at Wake Forest University. Neither Melissa nor I have any disclosures for today's talk.
In regards to our objectives, our goal is to prepare educators to incorporate exercise medicine and physical activity promotion early and often in medical education.
We also hope to provide foundational exercise medicine and physical activity promotion learning options for medical students entering all specialties.
And finally, we would like to discuss clinical applications of exercise medicine and physical activity promotion in medical education. As an introduction, physical inactivity is one of the 4 major risk factors of non-communicable disease and is responsible for greater than 70% of all deaths worldwide. The World Health Organization global NCD target is to reduce physical inactivity by 10% by the year 2025. Physical inactivity is a preventable and modifiable risk factor, and evidence-based medicine indicates mortality benefits from exercise for secondary prevention of cardiovascular disease, heart failure, and diabetes. And in fact, exercise training is associated with decrease in HbA1c, improvement of functional limitations, and prevention of some cancers.
Given the importance of physical activity for our patients, it is crucial that our learners develop the foundational knowledge that they will need to ultimately prescribe exercise to their patients as they move forward in their training and in their practice. Currently, education on exercise medicine and physical activity is limited, not only in the United States, but worldwide. Our goal is to introduce these fundamentals early in education, starting with our preclinical medical students in their pluripotent years, meaning that at this stage, they still don't know what they may ultimately practice in terms of specialties. We know that there are currently gaps in medical school and graduate medical school education, and our hope is to break down some of these barriers and begin the education process. We hope that folks can learn the basic principles of exercise and physical activity in terms of its prescription and its benefit for disease prevention and health promotion. We have 3 domains in terms of our education foundations. The first domain is that of the foundation of exercise medicine and physical activity. It is important that our learners in the preclinical years understand the basics of exercise and health medicine. This may be done through describing the roles of exercise medicine in disease prevention and treatment. For example, asking a group of students to list as many conditions as they can think of that have good evidence supporting treatment or prevention. We also would recommend reviewing the standard recommendations for physical activity. What are current guidelines or what are current recommendations that our patients and the learners themselves should be undergoing in terms of their physical activity? And finally, outlining things like FIT, or frequency, intensity, time, and type, or also volume and progression in terms of the foundations of exercise medicine. It'll also be important to understand the basics of exercise prescription. What does it mean to write a prescription for our patients? What does it look like in terms of dosage, frequency, all of those elements that will go into our students understanding exercise promotion.
And to add to that, understanding the basics of behavior change is a third part of the general learning area of this domain. An example would be to define models of behavior change and review the practical aspects of motivational interviewing and brief intervention that can be used in the clinical setting. And some examples would be learning by observation, involving a student in patient interactions and debriefing afterwards on the patient encounter, thus helping students learn practical interviewing skills.
Domain 2 involves exercise prescription in medical conditions and special populations. This is looking specifically at organ systems or other conditions that have good evidence that exercise may benefit. For example, during the cardiovascular organ system, the importance of cardio rehab in the treatment post-MI or after a diagnosis of CHF, or also in the prevention of those conditions, could be stressed.
And another example would be in the musculoskeletal system, for example, knee arthritis or lower back pain or even physical disability, looking at exercise options and safety modifications so a patient would be able to exercise in a safe and effective manner.
Lastly, Domain 3 covers exercise medicine and physical activity promotion in clinical practice. We think it's very important for our students to learn how to write exercise prescriptions during their preclinical and clinical years. The key domains to this are assessing a patient's current physical activity and then being able to give appropriate prescriptions based on their current level to help get them to the minimum recommendations, and using their knowledge that they gained on special conditions to help guide this prescription.
And the second part of the general learning area involves promoting community engagement. And examples are learning social and economic barriers to physical activity, as well as identifying community resources available for patients to engage in physical activity. For example, identifying community or senior centers, or possibly a local church or gym or pool facility that would be able to facilitate exercise. When discussing practical elements, assessing physical activity levels and writing exercise prescriptions for 5 patients as part of an ambulatory clinical rotation would be an example, i.e. a family medicine clerkship. Another element would be addressing physical activity levels and writing exercise prescriptions for 10 patients as part of an ambulatory acting internship or sub-I rotation. Additionally, identifying community and home-based resources available for patients to be able to engage in physical activity. And finally, participating in a local fitness event, such as a charity run or a group fitness class, would be another example of a practical element.
If time and resources allow, we'd like to offer some additional content that may be used for medical student training. Things like scholarly projects or quality improvement projects, serving as a health coach or working towards creating educational handouts, or even things like creating exam or test questions specific to exercise medicine and physical activity promotion, may encourage the students to have an increased vested interest in this topic.
The next slide will focus on assessment and evaluation of student performance in exercise medicine and physical activity promotion. And we have a few tools and guidelines to provide a structured format. One would be using a standardized checklist, possibly in an OSCE type setting, and observe a student counseling a patient on exercise and physical activity. Another example would be using a standardized checklist, again, possibly in an OSCE type format, and review a written exercise prescription from a particular patient encounter. Another example would be administering a short answer or essay exam to assess student learning of curriculum content, or even reviewing a written description of what the student would do in response to a presented case to assess student learning.
So the key take-home points that we hope you are able to take back to your medical schools and employ or consider beginning the process of teaching students the importance. The first is, of course, that there's good evidence that exercise is beneficial for just a myriad of conditions. Countless conditions have been benefited through this, and so we need our students to know that this is important. Secondly, medical school education for this topic is foundational. It's fundamental in that we have students that will be going into all different types of specialties, and we know that all different specialties and the conditions within those specialties will benefit from this. And so we really want to emphasize that regardless of where their careers may take them, that this topic is vital to their education.
We wanted to provide you with some additional reading material that was helpful to us as we prepared this talk. We hope that this presentation will serve as a helpful guide in your educational curriculum planning. Thank you on behalf of Chris and myself for participating in this Living Library series as part of the 2021 AMSSM Research Summit on exercise medicine and physical activity promotion.